This is Mary Moore, and this is medication administration down an NG or a feeding tube. So first, let's begin with some fast facts related to this route of medication administration. Nurses cannot assume that an oral medication taken by mouth can be safely given down an NG tube or a feeding tube. Tablets, capsules, and gel caps must be altered in order to administer them down the tube. So the nurse must first crush a tablet or open a capsule or dissolve or pierce a gel cap and then mix that medication with either water from the tap or bottled water or on occasion sterile water. However, beware, not all medications can be altered. For example, sublingual, enteric-coated, sustained release, and extended release medications cannot be physically changed, and there are many others on the list as well. Always check an up-to-date do not crush list or a drug reference, or when there are still questions, consult with the pharmacist whenever you are crushing or altering medications. Additionally, multiple medications due at the same time cannot be mixed together into a medication type smoothie. The Institute of Safe Medication Practices tells us that mixing two or more medications together, whether solid or liquid, creates a brand new, unknown entity with an unpredictable mechanism of release and bioavailability. Medications must be given separately with water flushes in between. Do not mix medications directly with tube feeding formula. Mixing drugs with formula could cause a drug-formula interaction, leading to tube blockages, altered bioavailability, and changes in bowel function. The feeding should be stopped and the tube flushed with 15 to 30 milliliters of water before and after administering each medication. If an NG tube is being actively used for decompression, do not administer medications into the stomach. The use of decompression signals a problem with peristalsis. Complete a comprehensive abdominal assessment and consult with the doctor. Just a reminder, don't forget to turn off the suction when listening for bowel sounds. The suction sounds can be misinterpreted as bowel sounds. Procedural comments. Before administering medications down an NG or feeding tube, each and every time the nurse must first assess placement of the tube. Remember to use evidence-based practice and follow your agency policy. Next, the nurse must assess gastric residual volume, or we can say GRV for short. In this case, GRV is the volume of fluid in the stomach at the point in time before medication administration. A large volume GRV is an indication of delayed gastric emptying. Giving medications, which requires adding more volume to the stomach when there's already a large volume there, could put the patient at risk for nausea, vomiting, and aspiration. The medications may also not be absorbed properly. If GRV is high, hold the meds and call the doctor. Return the GRV to the stomach to prevent fluid and electrolyte imbalance, unless, of course, the volume is excessive. Remember to use an oral syringe to measure all oral liquid volumes less than 10 mL. Refrain from using an injectable syringe in order to avoid a possible wrong route medication error. Please note the NRL policy on how to manage gastric residual volume. If the GRV is less than 250 milliliters, return it to the stomach and proceed with the med pass. If GRV is greater than 250 but less than 400 milliliters, return the GRV but hold the meds and call the doctor. If GRV is greater than 400, hold the GRV and the meds and call the MD. On this slide, there are parameters for flush volume. So this can be used for your reference. The volumes that are used as pre-flush, post-flush, and in between meds when giving medications down an NG or a feeding tube. Post-administration, if the patient is still on an NG tube that is attached to suction, we would hold the suction for 30 to 60 minutes and we would raise the elevation of the bed to at least 45 degrees for 1 hour. Anytime we are putting a large volume of fluid into the belly, we want to go a little bit higher on the angle of elevation to be sure that the patient doesn't regurgitate and potentially aspirate. And on that note, don't forget the very important implementation of aspiration precautions with any patient who has a gastrointestinal tube, most especially the nasogastric and the nasointestinal tubes, as these tubes pass through the lower esophageal sphincter, preventing it from closing completely. Aspiration precautions include that the head of bed is elevated at 30 degrees at all times. However, post-feeding or medication administration, we're going to keep that head of the bed up higher, at least 45 degrees or more for 1 hour. Ensure there's functional suction equipment at the bedside. Keep a Yankauer suction catheter handy in the event the patient should vomit and could potentially aspirate. We would keep that Yankauer handy so we could clean out their mouth. And then lastly, be sure that there is oxygen equipment readily available at the bedside. And this concludes the presentation on medication administration down an NG tube or a feeding tube. Thank you.